Hi everybody, my name is Dr. Girl. Today we're going to be talking about how to connect to your pelvic floor in life and in fitness. And I want to thank you guys for joining me here today because there are so many places that you could be, but you are here learning about your body. Really brief introduction. My name is Dr. Girl. I'm a holistic fitness coach as well as ortho pelvic floor physical therapist. All that means is I treat pelvic floor conditions, incontinence, prolapse, pelvic pain, pretty much anything that has to do with down there. I treat orthopedic conditions, neck pain, back pain, shoulder pain, hip pain, foot, knee, pretty much pain anywhere in our body. And I holistically integrate everything that I do as a physical therapist into fitness so that we're able to transform our body and health without pain, discomfort, leakage, and go even beyond that. I am a mom, a business owner. I call myself an athlete. I dabble in a few different things. And I like to look my best, feel my best, and function at my best. And talking about the body and all of these beautiful connections that you are about to learn about is my absolute passion. Now, why should you even care about the pelvic floor? Do you pee your pants at all? Few drops, a full stream, or when you put the key in the door, you turn on the faucet, you immediately have to book it to the bathroom. Sometimes you make it, sometimes you don't. Do you have to go to the bathroom all the time, like every hour during the day or multiple times at night? Do you have heaviness or this dragging sensation in your pelvic region? Pain. Pin your pelvic region. Pin your hips. Pin your SI joint. Pin your belly. Pin your back. Maybe your neck. Or anywhere else for that matter. You can't orgasm, or your orgasms are just kind of, nah, like that was it. Or you don't want sex, like, why would I want to have sex? Or it maybe even just hurts a little bit. You struggle with getting pregnant. And maybe as a result, you are on IVF. You have horrible periods or PMS symptoms. And maybe as a result, you are now on birth control. You have a bloated pooch belly or a persistent DRA. And you've done everything that you're supposed to do to lose it. You've dieted, you've exercised, you've even done your core exercises, but nothing seems to be helping. You have flared ribs or this poor posture. And every time you look in the mirror, it seems like it keeps getting worse and worse and worse. And now maybe you just don't want to put on clothes like you used to before, just because you don't feel confident in your body. You have a flat butt, talking no butt, nothing, pancaking. And maybe you've done everything that you're supposed to do to gain that booty. You're in the gym, you're doing your hip thrusts, you're doing your RDLs, maybe you're doing your split squats, but nothing seems to be popping up back there except some back pain and maybe some neck pain. Or you just generally don't feel well in your body. Your energy's off, you're exhausted, your mood's off, you're a little bit anxious, maybe a little bit depressed. Or you have these random symptoms, these random seemingly insignificant symptoms that just keep popping up everywhere in your body. All of these are signs that your pelvic floor directly and indirectly might need a little bit of help. Did you know that taking care of your pelvic floor with the holistic fitness focus can help you have reduced leakage and less trips to the bathroom, reduce pain and discomfort all over your body, allow for pleasurable sex because sex should be pleasurable, improve your chances of fertility, reduce your PMS symptoms, help you have a slimmer midsection and a better posture, a rounder, plumper booty, and adjust a better overall physique and health? We're going to discuss how you can do all this so that you could live your life with confidence in your body. Why? Because you deserve to live your life with confidence in your body, with your body helping you rather than holding you back. I am here to teach you how much control you have over your body. These symptoms, to an extent, is your body just telling you something's off. And it is our job to listen, our job to connect to what our body is saying. All right, so meet my hardest patient. All the symptoms that I just mentioned, I've treated and worked with each of these over the course of my career. I've also experienced almost all of them, but differently at different points in my life. I've learned through extensive research, through working with hundreds of clients over the course of my career, and my own frustrations with my body. I know exactly what it feels like to be stuck and frustrated with your body. Stuck and frustrated when doctors tell you that there's nothing that they can do or that that's normal. How many times have you heard that? It sucks, right? And even though I've always been athletic and relatively healthy, I've had these seemingly insignificant issues that I brushed off as normal. But it was not normal. It was common, not normal. And I want to talk about it so that we can take away any stigma that we have surrounding this. Help you know that you are definitely not the only one. That this can be addressed, and it should be addressed because I know it affects how you live your life. And it could affect your life even more as time progresses. And because I wrote it off as normal, and getting older, these symptoms started to impact me even more and more, to the point where how my body felt affected how I showed up in my day-to-day and who I wanted to be. I had a vision for myself. My vision was literally this: to give women better control of their bodies. But even as a highly trained professional, I struggled. I struggled a lot myself. And you know what? I am happy I went through all of it. Yes, super scary, super frustrating, but it made me question everything that I was taught and really dig to understand the body and all of its connection. And it brought me to where I'm here today, to help you learn from my mistakes, the mistakes of all the people that I worked with, the mistakes of all the people that are being perpetuated by social media in this unrealistic standard, and sift through all the information that's out there and give you information that you could trust, backed by a skilled professional that cares and has actually lived through it. All right, here is what we are going to go over today. What is the pelvic floor and how do you use it? What causes pelvic floor issues and how to fix it? You're going to want to watch all the way to the end to get to the how-to. But the information that you get leading up to the how-to is vital in fully understanding of how to best help yourself. I want to give you this information so that you could fully understand your body. You are about to get so many of these aha moments. To be fully transparent, at the end, I will offer you my holistic fitness coaching program, which starts at $247 per month. But I say this now just to get that pressure out of the way so that you could fully absorb everything that I'm trying to teach you about your body. You are really about to learn so much right now. All right, so first, let's bust some myths of some things that are probably holding you back right now. Myth number one: if you have pelvic floor issues, just do Kegels. No. As a pelvic floor physical therapist, do you know how many Kegels I felt that were people just squeezing their butt? They're just squeezing their butt, not really even squeezing their pelvic floor. We are going to get into what a Kegel is, how to do one, but what is actually better than a Kegel. Number two, you can only have pelvic floor issues if you've had kids. Though it is more common to have pelvic floor issues after having kids, you can have pelvic floor issues whether or not you had kids. Some of us may have had a degree of pelvic floor issues before having kids. I did. Before kids, did you have moderate to severe PMS symptoms? Maybe sex hurt. Maybe you had pain with putting in a tampon. You had a bloated or pooch belly, a flat butt, maybe some constipation, or you struggled with athletic events when you were younger. All of these are signs that your pelvic floor might just need some help. Myth number three: painful periods are normal. No. Moderate to severe PMS symptoms are not normal. This is a sign that your body is giving you that something is off. Your pelvic floor is a piece of this. You should not be in severe pain. You should not be laid out all day. You should not be going after pad in pain. You should not be snapping at everyone the week leading up to your period, or have to take a whole week off from the gym despite you being highly motivated to reach your goals. If this is you, I don't want you to feel bad about this at all. And again, you are not the only one. But you do not have to live your life with severe impacts due to your period. There's so much that you could do about it. If sex hurts, just have a glass of wine. No. The only thing that glass of wine is doing is getting you a little bit tipsy. We need to address why it hurts in the first place, not just cover it up with a glass of wine. It is normal to leak after having kids, though it is extremely common, very common to leak after having kids. And again, if this is you, you are not the only one. But this is not something that you have to suffer with. There's so much that you could do about it. Do you remember the activities you used to do before you used to leak? This does not have to keep disrupting your life. And you can't exercise with pelvic floor issues. No, you should. Exercise is extremely important in resolving your pelvic floor issues, but how you exercise is going to be even more important. And it's not just do more Kegels and more core work. There's more to it, and that's what we're going to get into today. And last but not least, surgery is your only option with pelvic floor issues. No, most of the time there is a better solution, which is what we're going to discuss today. Address the root cause of the issue. All right, what is the pelvic floor and how do you use it? Your pelvic floor is a sling of muscles. It's a bowl of muscles. This right here is your pelvic floor. So I just want you to picture this as a bowl of muscles. It's responsible for bowel, holding your poop in, letting it go. Bladder, holding your pee in, letting it go. Sexual, it allows for arousal and it allows you to orgasm. It holds up your organs, your bladder, your uterus, your digestive content. Everything sits on top of these pelvic floor muscles and movement. Your pelvic floor helps you move. If you take away anything from this presentation today, your pelvic floor helps you move. Your pelvic floor is an extremely important part of our foundation of how we move as humans. And as humans, we are creatures of movement, and our pelvic floor is a vital part of this. Now, how does it work? It works just like any other muscle in our body. But because of these additional functions, sometimes a little TLC is important. All right, so just like your bicep, let me see if I can get my bicep on here. Okay, it works by contracting and shortening. This is your bicep contracting and shortening, and these muscles moving closer together. And then it works by lengthening and relaxing. This is weird. Okay, these muscles moving further apart. Within your pelvic region, when these muscles contract and shorten, they lift away from the ground. These muscles lift away from the ground. This lift away from the ground is a pelvic floor contraction or a Kegel. If you want to try it right now, you'll picture this as a slurping of a milkshake through a straw with your vagina. You're going to feel a uniform lift in the front and in the back. That right there is a Kegel. That right there is your pelvic floor contracting. Your pelvic floor needs to be able to contract, but again, it also needs to be able to lengthen and relax. These pelvic floor muscles lengthen and relax, and they move closer to the ground. So they let go, lengthen, and move closer to the ground. These muscles need to be able to do both. It is not just contract, strengthen your pelvic floor. They need to be able to contract, but they also need to be able to lengthen and relax. They need to be able to do both. We need to be able to contract, to be able to move, to do all the things that we need to do throughout our day, to be able to lift stuff. And these muscles need to be able to contract to orgasm. These muscles need to be able to lengthen and relax, to be able to move, to get into various positions, to allow for arousal and allow for insertion. They need to do both. I'm going to say this one more time. They need to do both. They need to be able to contract and shorten and lengthen and relax. When they're able to do both, they need to be able to do both. This is what allows for proper function of our pelvic floor. Proper function of our pelvic floor is what allows us to do things without pain, discomfort, leakage, and go beyond that. What causes pelvic floor issues? In life, we don't just contract our pelvic floor by itself. These pelvic floor muscles are working with other muscles at the same time. This is typically referred to as this deep core or your core canister. You might have heard this before. Your deep core or your core canister is your pelvic floor muscles on the bottom, your transverse abs, which is your deepest layer of ab muscles in the front, your diaphragm, which is your primary breathing muscle on top, and your multifidi, these deep muscles within your back. All of these muscles work with your pelvic floor. So you don't necessarily have to remember all of these muscles because this might be the first time that you're hearing this. But I want you to picture this as a water balloon in your belly region. The bottom of the water balloon, that's your pelvic floor. The front of the water balloon, that's your deep abs. And when I say deep abs, I'm not talking about the abs that we train, that six-pack ab muscles up. I'm talking about the deepest, the innermost layer of our ab muscles. That's the front of the water balloon. The top of the water balloon, that's your diaphragm. That's our primary breathing muscle. And then these deep back muscles in our back. And then inside that water balloon, the water, this is our internal organs. Again, our pelvic floor is just a piece of this deep core canister, or this water balloon. These deep core muscles control what is called your internal pressure. This internal pressure is vital in understanding pelvic floor issues, but plays a major role in so many other issues in our bodies as well. This internal pressure is the pressure within our chest and belly from the air that we breathe in and our internal organs. I want you to picture an air balloon in our chest. This is our lungs and rib cage, and a water balloon in our belly. This is our deep core with our internal organs. This internal pressure is just all of this stuff that's inside of us, this air and water. Normally, this pressure should be relatively evenly dispersed between our chest and belly as we breathe and move throughout the day. But when we lose proper function of our deep core muscles, this internal pressure, or this air and water, it's going to push down on its most vulnerable points. Due to a few reasons that we're going to talk about in a few, a lot of the times it's our belly and pelvic floor regions directly leading to the symptoms that we experience. Pooch belly or DRI because our organs are pressing on our ab wall. Pressure or prolapse because our organs are pressing downward onto our pelvic floor. Incontinence or leakage because our organs are pressing downward onto our pelvic floor and our pelvic floor muscles can't do the job that they're supposed to, which is to hold the urine in so we leak. And pain because these muscles are fighting a never-ending battle and losing. These muscles are taking a constant beating, so they hurt. So even though I brought you here talking about the pelvic floor, I'm not just talking about the pelvic floor. I'm talking about this deepest layer. Your deep abs, your deep back, your diaphragm, and your lungs and rib cage on top. I'm talking about these balloons. Your pelvic floor is just a piece of this that may be taking a beating due to excess pressure on it. But when we have proper use of our balloons, this is what allows for better pressure distribution, better overall function, and reduce symptoms. Now, can you think of what can potentially disrupt this internal pressure? I'm sure you guys have a few guesses. All right, for one, pregnancy. During pregnancy, there's going to be this natural lengthening of our ab wall and pelvic floor to accommodate our growing baby. This is why a DRA or a diastasis rectus abdominis is normal during your pregnancy. Did you know that? It is normal to have a DRA during your pregnancy. Here's the thing. When these muscles become lengthened, when these muscles are lengthening to accommodate our growing baby, they're not going to work as well as they did previously, or they're going to feel a little bit weaker, which can be why if you already had weakness in this area, you can experience more issues during pregnancy. Though we can't avoid the DRA, we can avoid the symptoms associated with it by being proactive about it. You could actually help your body by learning better to connect with these muscles before or during your pregnancy. This will help with the health of you and your baby, help you have a pain-free pregnancy, an easier birthing experience, and returning to feeling like yourself quicker after baby. Though the separation, it's almost inevitable, the symptoms are not. And this brings us into postpartum. Whether you've had a belly birth or a vaginal birth, either way you've carried a baby for nearly 9 months. You experience trauma from pushing or trauma from the actual birthing process. And if you had a C-section, that was a major abdominal surgery where they just cut through 7 layers of tissue and then stitched you right back up. These muscles don't just snap back. These muscles don't just return back to how they were before, especially after baby 2, 3, 4. These muscles were overstretched and suffered from the birthing trauma. As a result, they don't work like they used to. And when we don't retrain our core, our muscles stay in that stretched and weakened position. And again, all that pressure, that internal pressure that we just talked about, it's going to go to its most vulnerable or weakest points. And this is why we have that persistent gap or diarrhea, leakage, heaviness, pain, or despite your efforts, you can't get rid of your belly. We need that connection piece. And you might notice, you have pelvic floor issues. And I find this really common. When I see somebody for pelvic floor issues, usually it's not just their pelvic floor that is bothering them. That's usually just the most pressing matter at the moment. So when we have pelvic floor issues, you might notice neck hurts a little bit, shoulders might be a little bit pinchy, back's a little stiff. That's no coincidence. Your pelvic floor can bear the burden with tightness and tension in our body that squeeze us and contribute to more pressure downward. Tightness and tension in our neck, our back, our shoulders all squeeze our air balloon, put more pressure on our water balloon, contributing to more symptoms. And years later, as we're moving around throughout the day, doing our thousands of mom tasks, we're powering through the workday, or we're in the gym striving to reach our body goals. If you never rehabbed, or you didn't rehab properly, you never relearned how to connect with these muscles. And most of the time, these muscles don't just return back to normal. Your body can start to compensate with other muscles. This means we overuse other muscles in substitution for these deeper muscles. Tension in our neck, our shoulders, our back. Again, squeeze us and contribute to more pressure on us internally. And this is why things can get worse and worse over time, because our body continuously compensates and generates more and more tension and squeezes us and squeezes us and squeezes us. But what if I haven't had any kids? Or maybe you're thinking about your male partner. All of us are so different. Different genetics, different frames, different interests, different lifestyles, different levels of stress, different diets. All of these factors could potentially disrupt this internal pressure and cause us to experience different symptoms. Some of us learn poor habits growing up. Some of us stare at our phone, stare at a computer screen all day. Or you're maybe, like most Americans, you sat in school all day growing up. Some of us sucked in our stomach for years trying to give ourselves this itty bitty waist. Some of us arched our back trying to poke out our butt, make it look like we have something back there when we really don't. Been there. All this contributes to more tightness and tension in our body, more pressure. Bloat or constipation from a diet that you know you shouldn't be eating. You get the ugh every single time you eat. More pressure in our system, more pressure downward. Sitting from work or school all day long, never getting a chance to get up. More tightness, more tension, more pressure. Constantly on the go, and your body never gets a chance to relax. More tightness, more tension, more pressure. Improper exercise form, selection, or programming causes us to compensate with our more dominant muscles. More tightness, more tension, more pressure. And all of this tightness and tension and pressure in our system, it's going to put more pressure downward onto our pelvic floor, onto our belly region, giving us symptoms similar as to having kids, but before having kids, and in males as well. Though it might look a little bit different when we're younger, or we haven't had kids, or our parts are a little bit different. It's all a matter of controlling this internal pressure. And you may hear this question: do I have a weak pelvic floor or a tight pelvic floor? We have different portions of our pelvic floor, and different portions do different things. So while your weak pelvic floor has all of this pressure on it, these muscles are going to fight to hold everything up. Certain parts are going to fight while others stay weak, causing you to have a tight pelvic floor and a weak pelvic floor. You can have a tight pelvic floor and a weak pelvic floor at the same time. And this is what I find is actually very common. And when certain parts of our pelvic floor can't lengthen, while other parts are constantly contracting, this is a big part of the issue. Remember, we said we need our pelvic floor to be able to contract, and we need our pelvic floor to be able to lengthen. We need all parts of our pelvic floor to be able to contract and all parts of our pelvic floor to be able to lengthen. We need our pelvic floor to be able to do both. We need our pelvic floor to have proper function. All right, what is core dysfunction? I'm going to talk to you guys about my definition. Our core works best when our balloons are stacked over each other. This puts them in a better position for them to work. This is an ideal resting posture. Though we won't have perfect posture because we are imperfect humans, but at rest, we want to aim to have our balloons stacked relatively on top of each other. This is having a better alignment. On the left, this is what you're going to see when you have an ideal resting posture or a better alignment. On the right, this is what our balloons progress to look like when we lose proper function of our deep core muscles or have some core dysfunction. We lose this alignment in the proper function of our balloons. Now, this is happening to all of us differently, to different degrees, and for different reasons. And I think a slight degree of this is normal, especially as we're on this earth a little bit longer. But the more and more we lose connection with these muscles, especially with some of the outside influences that we're going to talk about in a few, this is when we're going to start to see more issues. Though this is an extreme exaggeration, and all of us are very different. I want you to picture this is what's going on inside of us when we lose proper function of our deep core. All of those muscles that we compensate with on the outside squish everything to the inside. Our balloons get squished from the top, from the bottom, from the back, and in the front. This looks like that sway back posture, or maybe even a neck hump. This looks like flared ribs or a wide rib cage. This looks like a pooch belly or gripping with those upper ab muscles. This looks like no butt because our muscles are literally squishing everything from all directions. This causes stiffness in our rib cage, which causes us to take short, shallow breaths. And when we take these short, shallow breaths, this is going to limit our ability to use oxygen. And oxygen is needed for everything in our body. But because our body is so stiff, we can't use oxygen well. This is exhaustion. This is feeling, this is that anxious feeling because we can't use oxygen and our body is so stiff. This compresses or squishes your spine, limiting motion everywhere. And we are creatures of movement. We need everything to move well for our body to be able to work. Poor movement limits the pumping and the function of all of our internal organs. This is gut issues. This is hormonal issues. This is reproductive issues. Because, again, we are creatures of movement and we need good quality movement for everything in our body to work. This compresses our spine and all the nerves that come out through our spine that go to innervate everything in our arms, everything in our pelvic region, our hips, our legs. This is muscles that hurt. This is muscles that are weak. This is muscles that might be numb or tingling. Or this is muscles that don't grow despite your efforts. Our resting alignment is where our body feels safe and is where we heal. This dysfunction tips our body towards this constant stressed state, which limits our body's ability to heal and plays a major role in any aches and pains and other symptoms that we are experiencing. This is all because our core is our foundation of how we move. And I want to ask you guys an important question. Why is our body last on our list? When our body is last on our list, this is where we experience so many problems. This is why a few drops turns into you straight out peeing your pants in public, so you just don't even want to go anywhere anymore. That just in case pee before you leave turns into you planning out your drinks and planning out your bathroom breaks on any trips. That dragging sensation turns into, sorry honey, mommy can't do that anymore. And that dragging sensation further turns into you not being able to work out and you feeling so uncomfortable about your appearance because you are consistently gaining weight. And there goes those health conditions because you can't be as active as you were previously and you are actively losing muscle mass. And this is those random symptoms that just keep popping up, hoping for your doctor to give you a solution while your health just consistently declines. And those years and years of painful periods, or those periods covered up by birth control, turns into infertility, which can turn into a hysterectomy, which can turn into severe menopause symptoms. And that painful sex turns into repeated arguments or resentment with your partner, so your relationship is suffering. And then one day you're just sitting here thinking about all the things that you used to do. And I want you to know, you are not too far gone, and you are absolutely not alone. And this is extremely common, especially in this crazy world that we live in. But I also want you to know, you are not broken. You are not broken. You are not broken. You just have some things that you need to work on. I want to change the way that we look at our bodies. You are not broken. You just have some things that we need to work on. Our bodies are so amazing, if you give it what it needs. The first step in relieving our pelvic floor symptoms, as well as so many other issues in our body that are indirectly related, is connecting with our deep core. We connect with our deep core by connecting with our breath. All right, so we're going to finally get into how to fix it. All right, right here we're going to be talking about normal breathing. Your diaphragm. Remember, we talked about it in the beginning. Your diaphragm is the muscle that rests right in between the balloons and is the driver of your breath. Remember, we have our air balloon in our chest and our water balloon in our belly. Our diaphragm works best when our balloons are stacked on top of each other. Inhalation is when we breathe in, that's on the left side, and exhalation is when we breathe out. All right. During inhalation, our air balloon gets bigger. When we breathe in, we're breathing into our lungs. As this happens, as our air balloon gets bigger, it's pushing downward onto our water balloon. As our air balloon gets bigger and pushes downward onto our water balloon is going to expand. Our water balloon is going to expand in the front, it's going to expand in the back, and it's going to expand in the bottom. Remember, we said our pelvic floor needs to be able to lengthen and relax. This is what happens when we inhale. Again, when we inhale, we're taking a breath in through our nose and our lungs and rib cage are expanding. As this happens, our abdominal contents move downward, and this causes lengthening of our ab wall, lengthening of our pelvic floor, and lengthening of our deep back muscles. This lengthening happens during the inhale. During the exhale, as air is being expelled, our air balloon is going to get smaller as air is coming out. As this happens, our air balloon lifts off of our abdominal region, and those muscles can lift off as well, so they move upward. As this happens, our bottom of the balloon contracts inwards, the front of the balloon contracts inwards, the back of the balloon contracts inwards, and everything compresses or contracts inwards. Guess what this is? This is that Kegel. This is that pelvic floor contraction with that deep ab contraction. As we breathe out, air is being expelled. Our pelvic floor muscles lift and contract. Our belly muscles contract inwards, and our back muscles contract inwards as well. All right, so this is what's going on the inside. Let's have you feel it. Again, our balloons work best when they are stacked on top of each other. What does this mean? Sit up tall. Sit up as tall as you can within your comfort zone. You don't have to force it, but just sit up nice and tall. Unglue your shoulders from your ears, whatever you're able to do. I want you to close your mouth and rest your tongue on the roof of your mouth, but don't have a whole bunch of tension in your jaw. Just try to relax. What you're going to do, I want you to take a breath in through your nose. When you take a breath in through your nose, you're going to feel air move into your chest, sides of your rib cage, your belly, your back, and lengthening through your pelvic floor. You're often going to hear this called this 360 expansion. That's the inhale. When you exhale, as air is being expelled, keep this nice tall spine. You're going to slowly, emphasize, slowly exhale. When this happens, you're going to feel a lift of your pelvic floor, compression of our lower belly, middle belly, rib cage as you slowly, fully exhale. One more time. Take a breath in through your nose. You're going to feel air move into your chest, sides of your rib cage, belly, back, pelvic floor, 360 expansion. As you slowly, fully exhale, you're going to feel that lift of your pelvic floor, compression of our lower belly, middle belly, rib cage as you slowly, fully exhale. Though this breathing strategy will differ depending on our goals and the specific activity that we're doing. This is the biggest part of our foundation of how we should move as humans. And when we connect with our breath, which is connecting with our deep core, this allows our wonderful bodies to be able to function as we're supposed to. This gives us pressure that's more evenly distributed. It allows us to heal better. It allows us to move and function better. And when we do decide to push it, we're able to build resilience and not continuously break down. All right, I know a lot of us, most of us, may have had a hard time connecting with this normal breath. And I want you to know you are not the only one. I'm actually more surprised when people actually do it correctly. So I want you to know it takes time. You have to do this with practice. So practice over the course of time. As you do this more and more frequently, it becomes easier. All right, so some other things. Sometimes we need to be in different positions. So you likely did this when you were sitting in a chair. Oftentimes, laying on your back, laying on your side, or maybe even on your hands and knees can often be an easier position for you to be able to feel this in. And we are all a bit different. And based off of our individual differences, sometimes specific positions might be a little bit better for us. Number 2, we need to address our mobility. Mobility restrictions in our neck, our shoulders, our back, even in our hips. They could be a problem in itself, but can also restrict this normal breathing. So sometimes it's important to be able to allow some of these muscles to be able to move a little bit better first. Applying this breathing strategy to mobility work, emphasizing this inhalation component, this 360 expansion, one, it's going to allow you to stretch or lengthen some of these muscles, muscles in your neck, your shoulders, your hips. But it's also going to allow you to kind of stretch things from the inside out. Oftentimes, our mobility restrictions will rest in our neck. It's going to rest in our middle back. It's going to rest in our pelvic floor region. When we incorporate this breathing strategy into our mobility work, this allows us to stretch us from the inside out so we see better results. 3, we need to address areas that have excess tension in it. Sometimes we just need a little bit of a boost. Tension from those compensations can make it difficult for some of those muscles to let go, even with mobility work, even incorporating this breathing strategy. If you live this way for a long period of time, your body remembers it. It holds this tension constantly, and sometimes it needs a little bit of a boost for it to be able to let go. Soft tissue work, dry needling, foam rolling, massage, internal work can often be very helpful in allowing these muscles to let go, to improving your mobility, and allowing you to connect with your breath so that you are able to move and function better. And because we are all so different, I suggest in working with a professional to know which specific areas you should have worked on because, again, we are all so different and we hold tension in different areas based on our individual differences. This could be particularly important for moms, those of us that are a little bit stressed out or a lot stressed out, have been dealing with an issue for an extended period of time, or have multiple areas in our body that have different issues, or are experiencing other health issues as well. So yes, you could take all of this stuff that you've just learned, but understand we still might need some help because we are all so different. Now, I have another curveball. These core canister muscles, they don't work by themselves. So I told you, I brought you here talking about the pelvic floor. These pelvic floor muscles, they don't work by themselves. These core canister muscles don't work by themselves either. We don't just breathe all day, we move. Like I said, we are creatures of movement. These core canister muscles work with muscles in your foot, your legs, your hips, your back, your rib cage, your shoulders, all the way up to your head. This is what controls your internal pressure in relation to how you move around throughout the day. The position of your foot, the position of your knees and ankles, the position of your shoulder blades, the position of your rib cage, and your head. They all work together. They all work together to help you to manage internal pressure, move, do what you have to do throughout your day, in life and in the gym. To have the best outcome, we need to have everything on board. This is why in dealing with pelvic floor issues, or any issues for that matter, we need a total body approach because it is all connected. This is especially important for those of us that are active. I said the breath is the foundation of our movement. We use a similar strategy when doing any activity throughout the day, though it might just look a little bit different depending on that activity. We can apply this breathing strategy into picking up a bag of groceries, walking up the stairs, carrying our kid, or reaching for an item on the top shelf. Everything requires this deep core control in coordination with the rest of our body. All the things that we talked about before, connecting with our pelvic floor, connecting with our breath and core, that is the first step. We need a total body approach. And this total body approach is what is often missed with traditional pelvic floor PT. Learning how to use your pelvic floor, your deep core, with the rest of your body. When we learn this total body deep core control and connection, we are able to apply it to any type of movement to be able to be symptom-free. I want us to be symptom-free. But what about beyond symptom-free? What about symptom-free and confidence in your appearance and confident in your entire function? That is what you get when you take this foundation and you apply it to strength training. All of these exercises here and more, when done properly, train your deep core, but also train your hips, your knees, your back, your shoulders, all at the same time. All of these things are working together. Strength training is vital for anyone and everyone. This is what trains your deep core to be stronger, to manage your internal pressure, no matter what activity that you are doing. This is what trains all those other muscles in our body, all those other joints in various places in our body, to be able to work with your pelvic floor, for them to move how they're supposed to, so that you're pain-free everywhere, not just symptom-free in your pelvic floor region, symptom-free and pain-free everywhere in your body. Over time, this is what helps you build muscle in the place that you're trying to target, like your butt, and not build a butt in your neck and back. This is what helps you lose body fat and keep it off, due to improving the functionality of your system and building muscle mass and increasing your basal metabolic rate and burning calories more efficiently. This is what completely transforms your body and health, due to the countless benefits of better quality movement and more muscle mass. This is what helps you build mental and physical resilience, because it trains your body to be able to handle stress so that you can be the person you need to be. Take on your day, do what you have to do, accomplish all the things that you have to accomplish, achieve your body goals, and do all the wonderful things associated with having a strong, healthy body. All right, movement is a large component of this, but I would be doing you a disservice if I didn't discuss all of these other factors, because these are absolutely at play. With bowel and bladder techniques, your pelvic floor needs to be able to relax. Again, I want to point this out. We don't just want a strong pelvic floor. We need a pelvic floor that's able to relax. With bowel and bladder techniques, your pelvic floor needs to be able to relax. Straining with number 2 or pushing with number 1 can cause you to have excess tension in your pelvic floor and can contribute to more symptoms. If it feels like a workout, your face is as red as an apple, or you could finish a whole TV show while on the toilet, chances are you may need better poop and pee strategies. For number 1, relax and stop hovering. Layer that thing up if you're out. If you're out and it's extremely nasty, I get it. If you gotta hover sometimes, hover. But for the most part, sit on the toilet seat and relax. Sometimes a few relaxing breaths, focusing on that inhalation, could be extremely helpful. If you still feel like there's some left in the tank, wiggle around a little bit or take a few gentle relaxing breaths. And with improving your movement, improving your mobility, getting your core to work a little bit better, over time, this will help this as well. Number 2, I want to change your life. Get a squatty potty or a poop stool to elevate your legs and help to relax your pelvic floor when you are going number 2. This will change your life. I'm so serious. This will change your life. Also, when you're going number 2, use a gentle exhale to get it out. So make sure you're not straining to get it out. Use a slow, gentle exhale to get it out. Elevate those legs. It'll make it so much easier. It'll just slide right out of you. All right. And then again, with improving your quality of movement, this will help with that area as well. More movement. This is for those of you that sit all day long. Again, sitting too much, excess tension in your body, more pressure. Try to move around throughout the day as much as you can. Walk as much as you can throughout the day. If you have a desk job, what this means, on your break, try to get outside and walk during your lunch break. Walk around the building. Walk up and down the halls. Walk around your cubicle. Take some marches in place. Do some type of movement throughout the day. Do not just sit there all day. Sitting in one spot all day is detrimental to our entire body. So move as much as you can. If it's not a lot, that's okay, but do what you're able to do. Nutrition. This is such a huge topic when it comes to pelvic floor issues or any issues for that matter. We are literally made up our food, and this is what fuels us to do everything throughout the day. We need both good quality and quantity food to support our body. In terms of quality, generally, we want to prioritize protein from whole food sources and have lots of fruits and veggies. This gives our body what it needs to rebuild and heal. At the root of so many of our issues is these highly processed and sugary foods. We want to avoid these highly processed and sugary foods as much as possible and give our body actual food. In terms of quantity, we want to make sure that we're not overeating, but at the same time, we want to make sure that we're not undereating. A lot of us know we shouldn't be overeating, and that can contribute to so many health issues. But so can running on a cup of coffee, a few snacks, and one meal per day. Both can be detrimental to your health, and both can put you in this stressed state, contributing to more health issues. This becomes an even bigger topic when discussing hormonal, metabolic, autoimmune, or gut issues. There are so many dietary changes that you could make to influence any and each of these if you are dealing with any of these health issues. My biggest tip in terms of nutrition: eat 3 to 5 meals per day with a protein and plant source in each meal. Prepare your food ahead of time. And be okay with every meal not being a 5-star delicious luxury meal. It's okay if some meals just get the job done. You'll actually do better if you have some meals that just get the job done, that actually just fuel your body. It's okay to just look at food as just fuel sometimes. You can enjoy your food, but it's okay to have meals that just fuel you to get the job done, to get you to where you want to be. I am also a big advocate for getting blood testing done to give your body good information. Yes, you could do a lot of things by just feeling what your body is telling you, but a lot of the times it's also really good to get some good information. And if you have that opportunity, might as well take it. Hydration. Make sure you are hydrated. I know it might seem counterintuitive if you're dealing with bladder issues. You might be trying to restrain from drinking water, but your body needs water. Your bladder needs water. So make sure you are staying hydrated. You should be drinking a little more than half your body weight in ounces of water per day. If you sweat a lot, you might need a little bit more, and you might need some additional electrolytes. This is things like sodium, potassium, magnesium. Caffeine. I'm not saying stop, because I understand a lot of us love our coffee and might even need our coffee. But understand, coffee is a bladder irritant and can exacerbate any of the things that you are feeling. So I'm just saying, be aware of the amount of coffee that you're drinking and the timing of your coffee. If you drink your coffee in the morning, if you drink your coffee first thing in the morning, I highly suggest, I'm not even suggesting, I'm going to tell you, drink your coffee after your breakfast. Don't drink your coffee first thing in the morning. All right, stress. Are you stressed out? Most of us are stressed out, and that's just because of the world that we live in. But when starting to care for ourselves, managing and reducing our stress is vital. It is so important. We can manage stress by journaling, taking walks, meditating, yoga, breathing activities, and mindfulness. But a lot of us need to significantly reduce the amount of stress that we are under. Our bodies are not meant to be in this go, go, go state all the time. And this is the reality for most of us. And our stressful lifestyle can be the major factor in why our bodies never get a full chance to heal, and can be a big part of the symptoms that we experience and why we can't reach our body goals. So here is what we do. Prioritizing and setting boundaries is essential in managing excess stress. And I know it's so much easier said than done. And for some of us, there isn't really much wiggle room, but do what you can. You'll be surprised how much these little changes can make such a big difference in reducing this mental load and how you feel. Because when we push it at work, at home, in life, in the gym, as a mom, or all the above, we constantly overextend ourselves. Our body never gets a chance to feel safe or get into this healing mode, and we never get a chance to fully recover. So we stay in this cycle. Prioritize what needs to get done and put off the less pressing matters. Ask for help and be okay with receiving help. It's okay. It's okay to say, no, not now, maybe later. Can you help me? Rather, we need to do this for ourselves, because if our cup is always empty, how do we fill up everybody else's? How do we show up at our best at work when we are constantly on E? How do we transform our bodies if we literally don't even feel safe in our own skin? My tip to you, map it out. Get it out on paper so that you can see it and not just have it all floating around in your head. This is one of the reasons why I love to keep a journal, and this also helps to get you off of your phone. Prioritize all the things that need to be done, all the things that you're working towards, all the things that you need to do in your day, all the things that you can actually hold off on. Realistically, make a to-do list. Realistically, block out time for all the things that need to get done. Realistically, block out time for all the things that you do to need to take care of yourself. And block off time for all the things that you actually enjoy to do, because this is an extremely important part of healing as well. And I said realistic. So you stick with it. You need to stick with it. You can't just keep jumping from thing to thing to thing to thing. Stick with it. Sleep. Sleep is where our body heals. Most of us do not get enough good quality and quantity sleep. As women, we need more sleep. We need 7 to 9 hours of sleep per night. Give yourself enough time to sleep. Relax before bed. Limit screen time before bed. Sleep in a cool, dark, quiet room. And limit your caffeine, especially caffeine after noon. And I really want to point this out. Put down your phone before bed. Scrolling through social media, seeing all the things that you should be doing, places you should be in life, how you should look, will stress us out before bed and will limit our sleep. The last thing that I want to talk about is your mindset. How you think about things will have an effect on everything in your body. If you constantly tell yourself, I can't do this, you constantly talk to yourself with unkind words, you call yourself fat, ugly, or you define yourself by your diagnosis, you constantly feel stressed by every little task, every little event from your life, your body feels it, internalizes it as well. And this propagates this cycle even further. Your mindset could be keeping you in this stress state. Your mindset could be keeping you in pain, feeling sick and unhappy with your body and life. Start to tell yourself you could do it. Hype yourself up. Be your biggest fan. Start to believe that you can do it and start to take action in getting it done. And give yourself time, consistency, and grace when getting it done. I want to repeat this last part. Give yourself time, consistency, and grace when getting it done. This is the hardest part and often the biggest misstep. Time, consistency, and grace. Time, it will not happen overnight. How long did it take you to get here? You can't do something once and expect to have the result. Consistency, you need to do it over and over and over and over again. 1 week will not cut it. And grace, you won't be perfect. And when you mess up, because you will mess up, because we are not perfect and we live in an imperfect world, reflect and keep going. And to all my people pleasers and perfectionists, recovering people pleaser and perfectionist right here, expect not to be perfect, because no one is perfect. Just do your best with what you have and focus on what you actually have control over. And when you mess up, this is just valuable information on what to do moving forward. And this is just a part of the process. This is a process. This is not something that happens overnight. And I want you to think for a second. What would you do if your body didn't hold you back, but you truly loved all that your body could do? I want you to see the future. Maybe tomorrow, maybe a month, maybe a year, maybe 10 to 30 years. Are you truly enjoying your life, or you're spinning in circles trying to figure out what is wrong with your body, spending on thousands of dollars at things that just keep you in this circle? Your future is based off of what you choose to do today and the series of choices that you make after this. I am teaching you this so that you could get rid of all of your pain and symptoms, so that you could feel your best every day, so that you could show up as your best every day, so that you could achieve every little thing that your heart desires, because your body is the vessel that gets you there. And I believe that you could do it because you are amazing and your body is amazing if you give it what it needs. I want to thank you guys for listening. I hope you learned something about your body. Whether you have pelvic floor issues, other aches and pains, or other health issues that are stopping you from reaching your goals, it doesn't have to, because our bodies are amazing if you give it what it needs. Connection, movement, and resilience. Though there are so many things that we do not have control over. Work, the kids' schedule, to an extent the people that we're around. We do have control over so much. We can control what we do with our free time, what we spend our extra money on, and the choices that we make in our daily habits. We need to accept the things that we do not have control over. We can't control everything, but we need to take charge in the things that we do have control over. Small, consistent changes over the course of your life make a huge difference. It's up to you to make this decision for yourself. And I know it seems hard right now, but what's really hard is when things get worse. And I've been in those rooms where people are just commiserating over how terrible they feel. And I hate to be in those conversations because it does not have to be this way. I want us to be sitting around talking about how great we're feeling and how great our life is. So please make this decision to start to take back control of your body, whether it's with me or someone else. You got this. You can do it. There's no reason why you can't. You got this. And if you are ready to take control of your body for the long term with support, this is why I created my holistic fitness coaching programs. My group programs are a unique, all-encompassing lifestyle, nutrition, and fitness program formulated at the deepest level to help you reshape and transform your body and health. In any of my group holistic fitness coaching programs, you're going to have the option to join any of my one-of-a-kind programs fit for your particular situation. You'll have everything laid out on an app for you to follow, so you know exactly what to do, and you have my support all along the way. This is for those of you that have any of the symptoms that we just discussed, or you just know you need some help. You've tried traditional methods, or you've tried it on your own, and it's just not working. Again, all of us are a bit different, and sometimes we just need help. Or your workout leaves you with aches, pains, no energy, potentially other health issues, and you are ready to change that. Or you're looking for prevention. I love when people are looking for prevention. This is not for those of you that are looking for a quick fix. If you are not ready to commit, or you're willing to sacrifice your health for the ideal appearance. We are going for overall health. Yes, body composition changes come with it, and sometimes they can happen quickly. But this is not a quick fix, and I won't give you something that could potentially harm you. Here is what you get. These are 6 or 9 month programs laid out for you in an app so it's easy to follow. Whether you're pregnant, newly postpartum, a beginner, advanced, you just know you need some help, or even if you're a dude. Each program is uniquely designed to maximize your entire system to see amazing results. It tells you exactly what to do each day so there's no confusion, but allows for flexibility to account for our individual difference because we're all a bit different. You'll have the isolated core mobility work fit for your particular level and progressed over time. I know a lot of the times you join a fitness app and you get these core exercises that you are not able to do or they actually hurt. Each exercise is going to be selected for your particular level so that you are actually able to do it and get the most out of these exercises. You'll have 3 to 4 workouts per week. You might be able to kind of play with it a little bit, and a video walkthrough and talkthrough of every single exercise so you know exactly how to do these exercises, where you're supposed to feel it, and what you're supposed to do if you're having a hard time with it. Workouts are either upper body, lower body, total body, or recovery focused. This is what helps you get stronger with the rest of your body, helps you build muscle, strength, and is working towards your body transformation. Cardio, like some people hear this word and they want to throw up a little bit. You'll have cardio options depending on your preference and schedule. I won't make you run if you don't want to run, but I'll give you cardio options that are fit for your particular level that you are able to do. I will teach you how to eat properly and give you samples on how to start eating properly and how to sustain this over the rest of your life. I will teach you health habits so that you're able to maximize your results. And with this, you have my 2-way in-app support all along the way. It's like having me in your pocket to answer your questions all along the way. For equipment, all programs can be performed at home or at the gym with bands, cables, dumbbells, a chair, a bench, with the exception for the Balance Booty program, which requires a barbell. And everything could be modified based off of your particular level and what equipment you have available to you. This is how you stop leaking so you don't constantly worry about where is the nearest bathroom. This is how you get back to not living your life in fear that your symptoms are going to make something worse. This is how you start to put on clothes again and start to feel like yourself. And you get back that confidence in your body. And you get back that confidence in your health so that you can be the best mom, so that you can show up as your best self at work, so you're able to accomplish all the things that you're able to accomplish, so that you show up as your best in your business, so that you could be the best version of you. And you get your ideal body. And I'm not talking about the ideal Instagram body. No, I'm talking about your ideal body. You do not have to look like everyone out there. I want to give you your ideal body so that you feel comfortable in your skin. Stop comparing yourself to everybody out there. Work to be the best version of you, not the best version of somebody else, the best version of you. If you're interested in moving forward with the group holistic fitness coaching program, I will have you submit a deposit for your consultation. This deposit is a non-refundable $147 fee that will go towards your first month if you're ready to move forward. If you are not, we will fully discuss your particular situation and your needs. So either way, after this call, you'll leave with a better understanding of your body and how to best help yourself. The booking link will be linked below. If you're looking for something that is more individualized, my one-on-one programs is a highly customized plan for those of you that would like more support, accountability, and would like to achieve your results quicker. And this is what happens when we address your individual differences with this one-on-one support that is made just for you. These plans are made just for you and come with a ton of support and a lot of accountability. So either of the two, if you're looking for the group programs or the one-on-one programs, either way, book your consultation. I hope you learned something about your body. And if anything, just make sure you are consistent with doing these things and you will see such amazing results. And I want to thank you guys for listening. If you guys have any questions, comments, please reach out to me. Make sure you follow me on Instagram at Dr. Aissa _ Dr. AISSA _ Follow me on YouTube at Connect the Body Dots. And I will see you guys next time. Bye.